Hi, my name's Scott and I am a healthcare assistant here and I've been working for 6 years. Seeing patients face to face daily, injections, blood tests, ECGs, diabetic reviews, blood pressure, general health checks, just everyday nursing tasks. There isn't really a typical day as such. Each patient is different for what they need. Every day there's blood tests and reviews, blood pressure, but every day is different, which I like. I like to keep it fresh and not get stuck and get bored. That would be the patients, our regular patients and our elderly patients definitely. Because they're regular, you get to see them often, so you know them, you know their family. They like to chat and they just enjoy coming to see you, which makes it nice for me as well. That can be the patients as well sometimes, if they're unhappy that they've waited to see a doctor, possibly unhappy with what their answers that they've got from the doctor. But you can always kind of resolve it with them and help them. So you do kind of win them back round and just resolve the issue. That would be when the patients are unhappy with wait times. They come to see you to kind of sound off to you because they're unable to see the doctor. So that can be a bit challenging sometimes. That would be with the patients, make the decisions with them that they're happy with. Going forward with their treatment, how often I need to see them. If it's a dressing, like a wound care dressing, what dressing to use. When I need to see them again to have the dressing changed. How we're going to manage their diabetes. But always with the patient, you agree the decision with them. Mixture of both really. You have your own set clinics, your own patients, so you're working on your own with the patient face to face. But if you do need help, you can always ask your colleagues. We're a small team here, very close, so we can always help each other if we need to. So it is a mixture. As I've worked here for so long and done this job for so long, I'm more than happy to work by myself, but also happy to help colleagues as well. People skills, definitely. There's a lot of communication involved with patients and also GPs as well, so you need to be able to communicate with people. You have to have empathy, see things from the patient's side, and just generally being able to speak with people, listen as well. You also need to listen to the patient to see what they're hoping to get and what their needs are. So a lot of people skills, I would say. I didn't really, it kind of chose me. I started here on reception in the admin team, and the training was offered to me quite early on, and I took it up, not really knowing if I was going to stick at that or go back to the admin, but I realised early on that the nursing side of it was better for me. It started off with the training courses. You go off to learn an individual task, so say like taking blood, and then you come back, put that into practice with the nurse observing, then you're signed off, and then you're able to do that by yourself and go off and do the next task. But a lot of it is practical. You have to be able to do it practically in surgery rather than just learning it. I think from the other healthcare assistants that I've met on training courses and just through meetings and things, it's similar to how I do it. They kind of get in to the NHS via an admin role or reception, and then are offered the course and try it out and then stick at it and like it. So I think it's similar to how I did it. That would be working throughout the pandemic, working in the vaccination centres, doing the COVID vaccines and the boosters. Also, we have a train station near my surgery, and there was a bomb there a few years ago and we was working that day, so we had to help with the casualties, which obviously is not normally a everyday thing for me. Ask lots of questions. You will love the job, but you do need to ask questions because you're not going to know everything straight away. As I say, a lot of it is practical, so you need to physically do it to pick up the role. But you will enjoy it. It is a good job to have. Probably that you're not going to know everything straight away and you will pick it up as you go along. But also, some patients are not always particularly happy and do take it out on you, but that isn't because you've done anything wrong, it's because they're in pain, they're unwell, and then they usually come back to say that they were sorry that they took it out on you.